So I will be talking briefly about the dental referral business case. Next slide, please. So for the business case, we, as with other healthcare fields, dental care is very dynamic and it's a very collaborative clinical process that connects, general providers with specialists and patients. And so the patient data needs to be accurate and safely transferred so that the provider-patient experience is cohesive. And so we identified, three specific areas in the patient visit scenario: the office operation, the general dentist visit, and then the specialist visit. And so two problems that were identified was, what and how data is captured during the dental visit with the general practitioner. And then the second problem was a lack of consensus on what data is needed and shared for the referral process. And so the IT solution proposed is one that can support the referral process by sending and receiving accurate patient data from one provider to the other across multiple information systems so that continuity of care is increased and the orthodontic referral process is safely expedited. Next slide, please. And so the use case I'll be presenting on is the orthodontic referral, which is currently under public review, and I'll talk a little bit more about that in a second. So under workflow on the left is basically the steps that were identified from the point of registration or scheduling an appointment with the general dentist up until the patient goes to the orthodontist and then comes back to the general dentist. And so basically the goal is to create like a bi-directional, cohesive transfer of information from one provider, so the general dentist that first examines the patient and then has, a dental assistant or some other entity, business actor, input that data into their EHR. And then the general dentist then refers the patient to the orthodontist for treatment. So very, the traditional referral process. So the critical step here would be step 4, where the general dentist refers the patient, and then the referral is created in that first EHR system. So now, the conceptual goal is to have the orthodontist see that referral reflected in their EHR system so that they can then add their information, and then the information is in one place. So it's, as I said, a cohesive, transfer of data that's accurate, and, we can see it and access it. And so from there, on the right, you can see the data categories that were identified by event as they connect to the clinical pathways, the workflow, and the data flow. Next slide, please. And so these were the FHIR resources that were identified in the dental referral business case that pertain to the data categories as they're identified here on the left. Next slide, please. So this was an activity diagram that I developed for purposes of one of the courses that I completed last semester. And so it's not following the BPM models. However, those models will be developed in order to adhere to the BPM standards. And so this was just basically my interpretation of the flow of data and, where the data is starting, where it's going, and then eventually where it ends up. And so this leads to next steps. As I mentioned, currently the use case is under public review, which means I developed a public review instrument with my preceptors. And so that is in the process of being distributed to current providers, general dentists and specialists. And we solicited their advice and their feedback and asked them to be subject matter experts for their expertise and their feedback on this proposed use case and the proposed standardization processes for the orthodontic referral use case. Next slide.